About 10 million people in the United States have peripheral vascular disease, and it's the leading cause of disability among people older than 50 and those with diabetes. The number of people with the condition is expected to grow as the population ages. We spoke with Dr. Mahmoud Eslami of Hoag Memorial Hospital Presbyterian in Newport Beach about the latest treatment for PVD.
Peripheral vascular disease is defined as blockage of the arteries throughout the body except in the brain and the heart. So the blockages that you do see in the heart or brain are primarily defined as cardiac disease or cardiovascular disease. The blockages that you do see, for example, in the carotid arteries, in the aorta, in the arteries of the legs, that's defined as peripheral vascular disease.
And what causes peripheral vascular disease?
Buildup of cholesterol in the wall of the artery, which results over time in narrowing of the artery, and as a result, lack of blood flow to that particular organ.
Can this disease be prevented?
It can definitely be prevented. For example, if you have a high cholesterol level and you could modify your cholesterol level either by means of diet, exercise, or medications, then it can be improve your chances of not developing peripheral vascular disease. One of the biggest factors in development of peripheral vascular disease is smoking. So if you're smoking, the chances are that you're putting yourself at risk to develop peripheral vascular disease. If you have high levels of cholesterol, treatment of cholesterol either by means of therapeutic lifestyle changes, meaning dropping your weight, having a better diet, and so on, can significantly improve your odds of not having peripheral vascular disease. If you're a diabetic and your diabetes is under good control, you could further prevent development of peripheral vascular disease. The other major risk factors is high blood pressure. If you have high blood pressure, the treatment of underlying high blood pressure can also decrease the risk of peripheral vascular disease. There are multiple entities and diagnostic tools that we have in order to, number one, diagnose peripheral vascular disease and treat peripheral vascular disease. Nothing replaces a good physical examination by a physician. So physical examination, looking for pulses, looking for abnormal sounds in different part of the body can sometimes lead you to the diagnosis. Next step would be CAT scan. There are special type of CAT scans and what we call CT angiograms that you could have done, and they will clearly show if there is any blockages. And primarily the gold standard of diagnostic tools is an angiogram that can be done, which at times is done not only to diagnose peripheral vascular disease but also treat peripheral vascular disease.